Hi, I'm Dr. Eti Ben-Shabbat from Brain Rehab Academy, and in this video I'd like to share with you my 2022 wrap-up and brain imaging lessons learned. So for those of you who don't know me, I teach brain imaging courses to rehabilitation clinicians, and as such I get to interact with many clinicians from various disciplines, various health services, and various countries as well. And it was astounding to see how similar experiences everybody were having regardless of where they were. And the global trends that happened this year was that restrictions on COVID reduced, which means more people got sick with COVID. So hospitals had more patients, more clinicians were getting sick, so staff levels were down. Clinicians who were limited with their holiday leaves over the last 2 years took holiday leaves. So health services lost clinicians to COVID, but also to annual leave as well. COVID also led to people reevaluating their life and the Great Resign. You might have heard of it. Many people deciding to leave the professions they're in. In the health system, we've seen a significant number of senior clinicians leaving their roles, which means that the system is draining from experience, but also there's a lot more junior staff that is trying to take up the slack, but is not skilled enough just yet. And in fact, the junior clinicians are struggling to get the supervision that they need. And so the health system is under strain, the clinicians are under strain, clinicians don't have enough time to see the number of patients they need to see, the clients are not getting the service that they need. In some cases, you can't even get an appointment, such as sometimes with GPs or with specialists. And telehealth has come on board, but it still doesn't fulfill all the requirements. What did this year show us with regards to brain imaging? Well, it showed us that clinicians who have brain imaging skills have an advantage. They have the brain imaging compass, the tool that gives them direction of how to direct their assessment and treatment. For example, having a clinician in aged care that can look at brain imaging and figure out that the person, although in aged care, should be getting rehab so that they can recover from their stroke. Or a clinician from a rehab setting that contacted me to see whether a person has a rehab potential or not, so that they know what kind of discharge plan they need to put in place, finding out that the person in fact is going to continue to need support and therefore planning discharge accordingly. Or another experience I had this year in which I gave a workshop in a clinic, a neuropsychologist clinic, in which most of the clinicians were experienced clinicians, and they had a complex case that they've been seeing for a while and wanted me to have or give them brain imaging input. And although they're excellent clinicians and they have the best assessment tools as neuropsychologists do, it still showed that brain imaging provides information that you cannot obtain necessarily clinically or with assessment. You need to look at the brain images to understand what's going on. And so I was able to provide a new way of looking at the patient, new approach, new direction, new clarity. So people with brain imaging can have that clarity that you don't have. And when you don't have time, this clarity is super important. You have that compass, you have that direction when you look at brain imaging. From a client's point of view, this year taught us about how devastating it is for clients. We had the seminars in November with John and Bridget, and they shared with us their lived experience of what it's like to have a stroke, a big stroke, when you are during COVID time, and how hard it is to access the services you need, the rehabilitation you need, and how devastating it is to try and recover when you are given very grim information and lack of hope, even though there was a capacity for recovery, as we saw in the brain imaging and discussed it. So this year I've learned even more just how important brain imaging is, particularly when time and services and resources become restricted. It also showed me just how important it is for clients to understand what's going on. And so in 2023, I have a couple of things that I'm planning to in line with those lessons, and I can't wait to share it with you as my first video in 2023. So take care, have a wonderful end of the year, and I look forward to exciting 2023.